these are the fun part, the sports are probably the fun part if you're tired with one. The Common 1-6 has a hands-on component of its assessment and of its learning process as well, which is called the Health Promotion Project. This is the name of the project in general, but every year we try to be creative and we choose as a relevant theme. And for this year's project, the theme is e-health, the new norm, the new competency. So basically, sure, if not all of you, but at least most of you, either a healthcare provider online or virtually through the 2 years of the COVID era, or basically heard of some who tried it, or heard about it in general. So basically, and then so this is what we think that it's not going to be only at times of COVID, it may even last beyond that, and the new norm, basically. New competency is basically because, and we touched upon that in our second session, is that you probably, as future doctors, you need at some point of time learn how to offer this service or learn how to manage your patients virtually or online, whether in diagnosing them, managing them, following them up. So it's something that you really need to be aware of. You need to be trained and equipped to become, inshallah, a potential virtual healthcare provider. Okay, so this is a proposal. It's going to be posted on this one, just to give you a framework of how the project is going to be structured and what are the major requirements. We'll provide you with details of the requirements, inshallah, down the road once you create your groups and so on. So the way it works, as included here, it's a team, it's a group project. So basically, we used to ask for 9 students to work together as one group. Inshallah, provided that your numbers have really exceeded any of the previous batches, and approved to a maximum number of 12 students per group. So you will work in groups with a maximum capacity of 12 students per group, and on one project, on one type, one topic. The topics for your opinions and for your better understanding, and to help us also arrange for the exhibition, because this project will work on it now, and at the end of the semester, on November 27th, you will be showcasing your work, your hard work as a group, and you will be asked to host a booth as part of the Health Project exhibition. And this is, a very sort of an annual event that Professor basically organized on an annual basis, and it's one of the very important social, academic, educational, and research-based projects that Professor hosts every year. So, just what I've just said right now, it's a project we created for this project. We will work on it as a group team, students. You will get the flexibility to choose your topic. We will the topics shortly on the screen. Your work on the project, and then at the very end, you will be asked to host a booth as part of the Health Promotion Project exhibition. You will be graded based on actual booth itself, and as well as the process when you are preparing for this project. So the assessment component includes both the ongoing preparation and development of your project, as well as the end product, which is the exhibition. Okay? We start the assessment component groups towards the 15% of this course. So this project weighs 15% of your total evaluated by judges who will choose the top 3 winners, the top 3 booths at the exhibition. Luckily, this year we will be able to host an exhibition again. Last year, of course, it was because of the precautionary measures, restrictions, and so on. The project needed to take place virtually. We allowed like a batch of the close family members to attend, like 2 guests per 1 student, and it was sort of on a batch basis, so there were no more than 10 people allowed. Anyways, we have this flexibility. We will announce when we will allow you able to apply to our family members, and luckily, the date of the booth, the exhibition, will be on a long weekend. So if your family members have to live out of town, they will be able to come on a Thursday because spend a long weekend if they need to, because Sunday is again it's an official off day. And it's on a Saturday, so you don't have to worry about your classes. You have the Friday to get ready as well and pay for your booth. So anyways, to give these details down below, what I really want you to understand, I'm just giving you the general picture. What you really need to know to do now immediately is to create your groups, choose who you will be with you in your groups, and choose your topics. Over the years, we've noticed that this is the most time-consuming step, and will hinder your progress towards starting and preparing for this project. And so, accordingly, we decided that to help you create your groups, to give you only a 1-week period where we prepare your groups, meaning we have all your group members uploaded in a template that Dr. Salim will post with your topics, not later than evening. Why is that? Because we can see groups posted on Moodle by Monday evening. You will not be able to mark your attendance next Tuesday. Okay, so in order to be able to mark your attendance next Tuesday as you attended the session, you really need to have all your groups created by then. And this is, of course, a great advantage. Because then we're giving you the flexibility to create your own groups, because it's part of the learning process. It's how to build a group, get on with other members, slide into the group leader, and learn all about the group dynamics and so on. So it's one of the very enriching experiences that you will never ever be able to experience in any other parts or any other courses while in you. So get advantage of it to the max. It's really a great learning experience from the content aspect of it, as well as all the thoughts that you will acquire as part of me throughout this journey that we call. Okay, so this is an idea. Can you put the topics, please? Again, so we thought of placing the topics into the core categories, because as you know, virtual health is becoming more available for people to seek help. They're in diagnosing their medical or health conditions, receiving their treatment. There's a patient experience behind it, and as well as the healthcare provider experience component. So, do you have any device that could be considered as an online or health or e-health device at home? Show of hand. And guess what is it? Any volunteer? Oh, the volunteer device, excellent. So it's becoming sort of an each health capacity kind of thing. What else, especially among both the COVID, what is that each device that is they don't really get relieved, right? So these are very simple, very simple development. Just by following, yes, exactly. So, and the minute you just monitor how many apps you have on your phone that are all health related, it's becoming So from apps on your phone, sorry, you want to say something? Exactly, the glucometer, the glucocheck or glucometer device. So from the apps that you have on your handheld or on your iPhone to Dr. Google, a lot of them just check for our next visit to the doctor to know what questions we should ask, what sort of national diagnosis that we should worry about, we should ask the doctors to get assurance that we don't have any of those. This is all sort of considered as e-health, basically aspects of our medical care, of our health, medical care experience. So this is the general overview. Once you pick your topic, if you have any specific about it, specific question about it, please let us know. For each of the topics, you need to cover the following components. Scroll down. Okay. So you need to just give us a general overview and introduction about that, the topic that you choose, where. Of course, those have been there for years. Like what is the glucometer machine, the blood pressure, digital blood pressure device have been there for years. So we'd like to know how heavily they were used, what sort of technology was attached to it pre-COVID. And then post-COVID, since we believe that COVID or the lockdown or all the turning point that COVID created made a big difference. And what are some of the challenges as well as the enablers that support or hinder the usage or the progress of such a device or such a modality? And then what's the future? Where we go from there? Do you recommend using it? What's the future ahead of it? Is it? And again, I'm not. Some of the examples that we mentioned here are very basic, thermometer machine and so on, but the topic is way beyond that. We're talking about robotic surgeries, for example, under surgery. We're talking about an ICU physician connecting with a team in a rural village, a village in a rural area, to monitor patients' progress. So it's a very broad topics that we can choose from. But again, the main categories are diagnostic, management or treatment, what is the patient experience, and the care provider experience. You don't need to choose from all of them, you need to choose one topic only. But the areas that you need to cover are those that are listed here. Okay? So we just spent like half an hour of today's session today. There will be from third and by before the end of before 10 o'clock we have to take more questions. If not, as I said, we will always have there are embedded sessions that are designated only to cover your topics, ensure that the work in progress is aligned with the project requirement. There is no one who gets an name in this project, so please utilize it to the max to improve your grades as part of this course. And I'm saying that because we really enjoy it, and we enjoy doing something jolly and active. So utilize it to the max as a learning experience that's fun and joyful part of this semester. And I'm sure you will all confirm this to me first and your exhibition today. Okay, thank you.
Guys, before we start, please leave one seat between you and your classmate. This is the last time I will mention it. The next time I will be asking you to leave the classroom.
كاش ميموري ولا ننزلها من موديل؟ هي restricted.
لا فينا ننزلها بس يوزر بريك.
restricted my
هي restricted بس نحن إذا بنعمل ساين إن بنقدر ننزلها.
والله لا خلاص.
يلا إذا عندك
مشان بس سليم إذا بدي أحط كمان بوينتر في له محل نقدر نشيل الفارغ.
لسه في كمان هون في.
والله. طيب. I hate this. خليني أول شي ننزل where is it where لا exams يعني فضيحة. stop sharing سليم stop sharing.
نسحب ولا الكابل ما في هون stop sharing يعني.
والله. يلا ماشي الحال. لا أنا بفضيهم اليوم خلي بس تبعوت شو اسمه what did I do okay
نحط البوينتر.
اي البوينتر في محل ثاني أنا هذيك المرة ما دخل. perfect يلا حلو الله يعطيك العافية خلاص خليني أحط أنا أحط هون ممتاز. Morning.
So good morning, everyone. I think Dr. Barat has already explained to you about the project. It seems overwhelming at the beginning, but once you started, you're gonna be more oriented and guided, of course, by us, okay? So actually, today I'm gonna talk about part 2 of maternal module. The first part, we talked about maternal health, isn't it? Okay, does anyone remember what is maternal health? Health of whom? The mother, very good. The mother when she is pregnant. Throughout her pregnancy or within 42 days after giving birth, right? So today what we're going to talk about is the fetal health, child and infant and child health. Okay. So today you understand what is the meaning of neonate, infant, and child, and also develop a knowledge about infant mortality, and then we will talk about the leading causes of fetal mortality and child death as well. And then at the end, I will also talk about what are the main causes of child death, which is injuries. Okay? So let's move on. Infant mortality rate is a gauge of society's attention to children's health. Do you approve or not? Justify what way? Infant mortality rate. Let's talk about the definition first, and then we will go on. Okay. So let's talk first about what is an infant, what is a new toddler and child. Do you have any idea? What is infant? Who's infant? Or neonate? Did you read it? Who's the infant? Newborn. Who said a newborn? Yeah. What is the age of newborn? First hour, 2 hours, first day. 42 days, 2 years. This is the infant. Okay, very good. So, F is not to 2 years, definitely. Any other trial? Yes, please. Very good. So, infant is from birth until 1 year of age. This is the infant, okay? Infant who is from birth until 1 year of age. Okay, neonate who was just born. No? This one, my pointer is, yeah. Okay. Newborn infant or newborn. What do you think?
He is a child under the 28th, under the 28th days of age. Okay? So this is the neonate.
Neonate is from birth to 28 days of after delivery. Okay? Infant is a young baby from birth to 12 months of age. So neonate, do you categorize it as an infant or no? Yes, of course. A neonate, he is at the first month of an infant. Infant is from birth to 28 days, to 1 year. Okay? And then you have toddler. Toddler is a child between 12 and 36 months. Then you come to child. Child, of course, has different terms, but under the WHO and CDC, it is until 18 years of age. Okay? So infant to the first year, toddler is to the third year, and then we have the child until 18 years old. Okay? This is very important. And I'll explain to you why. Or you may tell me why. Why is it? What should be just between infant and toddler? Is it exhaust you memorizing and something like this? Yes? What do you think? Someone from here? What do we categorize those or say about this? Excellent. Why should we categorize stages of life? Why is it important? Very good, excellent. So your friend was saying that means that we could understand the care that we need for that child and the development of that child. This is very important to monitor this, to monitor children during different periods. Okay? So let's go back and talk about my first one. So infant mortality rate. Infant mortality rate is the death or when the infant dies, unfortunately, within the first year of his age, is a gauge of society's attention to children's health. It is in fact an indicator of the health status of a population as a whole. So, that's true. Infant mortality or infant death or infant mortality rate would tell about the society, the health society. Is that true? True? What do you think? Is it true? Yes. Who says yes? Yes, please. Okay. Okay. Yeah. Is it that it tells about the society? Yeah. Why?
as a society to get it, but to get it to give birth to the child, for example, in the hospital without the age.
That the infant is going to grow, and if we take good care of the infant, it means that we are going to take care of the society, right? Healthy children means healthy society. Agree or not? Okay. So let's move on. This is the difficulty, as you can see. He wants to inform his parents about something, and he's shy to say it. And he will say, you will never see them again. She's not absolutely true. Stop. It's just only to a short period, like 10 years. Okay. So, actually, a newborn infant or a newborn is a child under 28 days of age. During these first 28 days of life, the child is at highest risk of dying. It is thus crucial that appropriate feeding and care are provided during this period, both to improve the child's chances of survival and to lay the foundations for life. So actually, as you can see, with the first 20 days after birth, it's important to take a good care of the neonate. Why should we take good care of the neonate? Because the neonate at that time has a lower immunity than adults, and he's susceptible to multiple infections, injuries, so he is very vulnerable. Okay, so it's very important for us to take a very good care of the neonate at the first 28 days of age. It doesn't mean to take care of the others or the children who are older than 28 or one month, but a special care should be given to this period. Okay? Why? Again, because the neonate is very vulnerable and he is susceptible to different infections that might cause him diseases, sickness, and sometimes, unfortunately, death. Okay? So, let's move on. Very nice. So, infant mortality rate. Let's talk about infant mortality rate. Infant mortality rate defined as the number of infant deaths within the first year of life for every 1,000 live birth. Those formulas, as I said before, they are very important, like what we talked about in Fetal. Why is it important? Because we need to know about the health of the society in general. And in order to know about the health of the society, we need to know the number of babies, number of infants who die every year, the number of mothers who dies every year. Okay? So those formulas are really very important. Let's move on. See about or talk about a little bit of statistics. It sometimes works, sometimes not. Okay. So, infant mortality rate is very low in Scandinavian countries and in Japan. It equals around to 2.6 per 1,000 live birth in these countries. In USA, it's also around 6.6 per 1,000. So, according to WHO, infant mortality rate has decreased from an estimated rate of 63 deaths per 1,000 live birth in 1990 to 32 deaths per 1,000 live birth in 2015 globally. As you can see, of course, in well-developed countries, infant mortality rate is very low. And globally, according to WHO, infant mortality rate has dropped to less than 50% since 1990 to maybe 50% of the number, which is 60%. dropped tremendously since 1990 to 2015. Do you know why? Why infant mortality rate has dropped that much? Anyone from the boys? Yes. Okay. Very good. Very good. So it's the developed or well-developed care of the infant. What else from the boys? Anyone from here? From at the back? No one? Why the infant? Yeah. I can't hear you. Please raise your voice. Improve medical facilities. What else? Awareness, improve the medical facilities, and also, what about education? Right? Improve education. Mothers now who are taking care of their babies are more educated, so they know how to take a good care of their babies, and they know when their babies need to, or they are at risk and they need to seek a medical advice. Right? Okay. My team was so sleepy, last time you were more active. What's happening today? Is it because of the project? First time, it's a very enjoyable experience. You will enjoy it. I promise. Or I don't want to promise because sometimes you won't enjoy it. I'm not really sure. But anyway, really, it's as I told you, it's over you at the beginning, and then we walk you through this. And it could be really a very different experience. Okay. So let's move on. Even my pointer is moving by itself. Okay. Very good. So this is actually a very important slide. It tells about shocking statistics. As you can see here, every year we have around 2.6 million babies die in the first 28 days. And that proves that what we have said is right. It's very important to take care of the children during the first month. Okay? So, unfortunately, 2.6 million babies die in the first 28 days of life, most in the first week. The top causes, I will talk about the causes later on. An additional 2.6 million stillbirths occur each year. Do you know what's the meaning of stillbirth? Yes, what? Death of the newborn or inside the uterus. When the baby is delivered and he is dead, immediately, either he died immediately after delivery, or he dies inside the uterus and the mother delivers dead baby. That's the meaning of stillbirth. Okay. So 75% of newborn death can be prevented with high quality care. As we said, healthy mother, healthy birth, good health in the first days of life equals the start of a healthy childhood. Okay? So if we have healthy mother, a good educated mother, and health-wise, she is very good, and then we have a healthy birth, it means the mother that delivers in a good facility, people around her, and also there are well-experienced staff, medical staff around her. It means a healthy birth. And then if we have a good health in the first days of life, if we take care of the baby during the first 8 days of life, this will have or will be equal to the start of a healthy childhood. You remember the number that we talked last time? How many women die every year, or how many infants that die or baby die without 7.67. So excellent. So 7.6 million of babies die, as we said, within the 5 years of the first 5 years of their lives. Okay? So 2.6 of them actually die within the 28 days. Okay. Now we will talk about this leading causes of infant mortality. Do you know any causes that might of infants within the first year? Anyone? That's fine. Cheap from here, no problem. We can talk about one reason and the other a little bit about it. What do you think? Yes, please. Oh, I hope he's friends. Very good. No vaccinations. What do you mean by no vaccination? So anti-vaccine families, they don't like to vaccinate. Very good reason, but this is very rare. We're talking about the leading causes. What do you expect for this vulnerable little one? What causes might cause is death? Yes, please. Malnutrition is a very good reason. What else? Yeah. Sorry? Premature birth. Very good. Yes. Diseases. Excellent. Yes. Genetic mutations. Yes. What else? The same? Okay. Yes. Excellent. Complications during birth. Hypoxia. Yes. Anything else? Very good, actually. Yeah. Very good. Accidents like head injuries. Yes. Infections. Excellent. So, we can differentiate between causes of the United States. When I actually mention United States, developed countries. So, causes of infant mortality in developed countries, first of all, is birth defects. Okay? Do you know what's the meaning of birth defects? Do you know what's the meaning of birth defects? Yes, it's actually, yeah. Excellent. Physical malformations. So the first cause of infant mortality is in developed country is birth defects. Birth defects means the malformation, genetic malformation. And then we have preterm birth. Preterm birth, when the baby is delivered before completed 37 weeks of gestation. And then we have sudden infant death syndrome. I will also talk about them more in a moment. Pregnancy complications. Some women, they might have bleeding and the placenta might be separated, so the baby will not have enough food and oxygen, and that's why sometimes they die. Accidents, whatever the accident is. Globally means in other side of the world, like in developed world, this is the leading causes of infant mortality. So globally, actually, number one is neonatal encephalopathy. Encephalopathy means brain malfunction, or brain damage. Brain does not work right, okay? So this is the first cause of infant death globally. The other thing is infections. Like in Africa, there are blood infections or blood-borne infections like malaria. Do you know what causes malaria? Anyone knows? Yeah? Yes? Very good. It's a tick bite that causes malaria, which is a very serious infection and might cause death of the baby.
Complications of preterm birth, as we said, premature babies who comes before completed 37 weeks of gestations. Those babies are at risk of multiple infections, of hemorrhage in the brain. So this also is a cause of infant death. Lower respiratory infection, pneumonia. Pneumonia means lung infection. Okay. The other one is diarrhea. Babies have as very small bodies. Once they have diarrhea, do you know what's diarrhea? Loose stool, right? So once they have that, they might have a dehydration. Dehydration is associated with loss of minerals and vitamins, and then the baby might die because of that. All right? So let's move on. You can see here, child mortality has dropped tremendously since 1950 to 2015. Tremendously. All over the world. All over the world, child mortality has dropped actually tremendously. In Africa also. But still in Africa, infant might die because of different causes or the causes that I have explained about. Okay, so where can you see the most child death in the world? In Africa. Would you tell me why? Why do we see in Africa more babies who dies? Or yes, please. Malnutrition. Very good. What else? Infectious diseases. Yes, infectious diseases such as malaria, as we said, especially malaria. Yes, what else? Anyone else? Yes? Yeah. Malnutrition or poor nutrition. Very good. Yes, please. I cannot hear you. What? Very good. Excellent. Healthcare system. Yes. Very good. Okay, yes, please. Poverty. Excellent. Excellent. Poverty. Poverty is, of course, the leading cause of death for children in Africa. Okay. Child mortality by income level of country. As you see, in low-income countries, child death is more than in high-income countries. So that's why actually Africa has a lot of death of babies. Okay, so low-income countries has an increased level of children death. Although, as you can see, children mortality has dropped tremendously for the last like 60 or 70 years. Okay, but still Africa is #1 in this thing. Okay, child mortality is related, as we said, mainly to poverty. Why poverty? Because poverty leads to less education. Poverty leads to less awareness. Poverty leads to less medical or availability of medical facilities and medical staff, right? So that's why the main actually cause of children death or child mortality is poverty. So child death is lower in high-income countries and higher in low-income countries. Okay, so let's talk about now the reduction in infant mortality rate and child mortality rate. Okay, as we said that there were a huge drop in infant mortality during the last 60 or 70 years. Why do you think so? Yeah, give me now. There are many reasons for that. Many reasons.
the mortality to be dropped from like 1950 to 2010. Why do you think so? Yes. Very good. Advancement in medicine. Here, people from here. Anyone? Yes. Immunization. Very good. Excellent. Yes. Okay, what about your friend who said no? Immunization, people who are anti-vaccines exposing children death. So what do you say? True. If the children do not get the needed vaccines, then they are at risk of death. Yes, please. Advancement in science technology. Yes, very good. How is science technology related to medicine? Very good. Excellent. Excellent, excellent. So science technology or advancement in science technology is letting us actually discover more genetic diseases and we can prevent those. Yes. Very good. Social education. What else? What else? We studied about the immunization, facilities, education, advancement in science. Yes, please. Follow-ups. Very good. Yes. Very good. Widely access to health care. Yes. Very good. Improvement in prenatal care. Very good. Excellent. Where do we find the prenatal care? Where can we find it? Prenatal care unit. Where can we go for? Very good. Prenatal units are part of family medicine, or they can be standalone in a hospital. Okay? Very good. So, actually, you stated most of the causes, which are the improved socioeconomic status and nutrition, immunization, of course, clean water, no pollution, right? So the pollution might cause, or environmental pollution might cause an increased risk for children to die because of drinking not clean water, dirty water, and also by breathing carbon dioxide and other gases that puts death to the children. Of course, advancement in medicine, advancement in prenatal care, technological advances in caring for premature infants and infants with low birth weight. And primary care clinics. This is very important to have primary care clinics in order to provide family planning services and prenatal care. So primary care clinics are important for two things. They provide an antenatal care or prenatal care, and also they tell the family about the family planning methods, which means the birth control methods. Okay? We did not talk about that, I think, last lecture. I'll try to we have time? Okay. So now, we will talk now the causes that causing child mortality. So, as we said, that 20% birth defects causes actually 20% of death in developed countries. So, there are some recommendations that has been put by the public health agencies in order to reduce the death of babies during the first year or during the first 5 years. One of them have genetic screening. for common diseases that run in family. And this is what we say it's a pre-pregnancy consultation, or we can do that in the first and second trimester of pregnancy. So one of the public health recommendations to reduce the percentage of congenital malformation, we're talking about only here birth defects. What are the rules or recommendations that were put by the public health to reduce the death of infants because of genetic diseases? The first one is to have a genetic screening before marriage. No, any kind of or any type of disease that usually we screen women for before they get married. Here in Saudi Arabia, there is a genetic diseases that we usually screen the woman and the father for before becoming or before beginning. Do you know those diseases? Anyone? Did you hear about those genetic diseases? Yes, please. Sickle cell anemia, very good, excellent. Thalassemia, very good. So the two diseases that here are very common, and we usually screen all couples for before marriage is sickle cell disease and thalassemia. There are also other kind of diseases or other type of diseases that are screened globally, such as cystic fibrosis as well. Okay, we can prevent that by doing a pre-pregnancy consultation, and then we can also. I don't want to go deep through this, but usually we do some kind of separation of those genetics. So it's kind of IVF. Okay. So other kind of recommendation that we public health recommends to reduce the percentage of congenital malformation is neonatal screening. Neonatal screening this is usually done after giving birth to a baby, and we can screen this baby for hypothyroidism. Why do you screen for hypothyroidism? Why do you think so? Why it's important to screen the babies for thyroid hormones? Yes. Very good. In order to treat the baby before the disease develop or cause some damages. Okay, like thyroid hormone. Why specifically thyroid hormone? Why we didn't say other kind of hormone? Yes. Important for hemostasis. Very good. Yes. Other thing. What do the thyroid interfere with? The potato inside. Yes. Yeah. So actually, the thyroid hormone is very well known to develop the brain. Okay. So that's why it's very important to screen all the neonates. Once the mother gives birth, we immediately do a screening for thyroid hormones, because thyroid hormones interfere with the growth of the brain. Okay? So, this is an important information that you might have in the exam, so pay attention to it. Okay? And I told you to take some notes for that. Sometimes if something is not available on the screen, you can, or on the slide, sorry, you can take a note. Okay. Public health recommendations to reduce the percentage of congenital malformation. Now we will move on to regulations of teratogenic drugs, include warnings on the package of the teratogenic drugs. This is very common sense. The pregnant woman should not, or try to avoid the medication as much she can. Do you know any teratogenic drugs? Any teratogenic drugs? Anyone? take usually? What do we give for the cancer patients? Chemotherapy. Very good. Chemotherapy might cause some birth defects. What else? Radiation as well also causes them. Okay, there is a very common medication that is taken by the young adults and teenagers, and it might cause birth defects if not discontinued before becoming pregnant, or 3 months before becoming pregnant. Do you know that medication? Very common. And I'm sure 50% of you are taking it or have or taken it. Yes? You are taking it. True. Vitamin A. Vitamin A orally, that's usually young adults or teenagers take it for acne. Okay? Do you know it? Very good. Okay. I will give you 10 minutes, but let me finish this slide. Okay. And then we have also the other thing that might cause defects is the immunization by itself. Immunization actually it protects sometimes against the birth defects. But if a patient has like a rubella virus, usually rubella virus causes severe malformation to fetus, especially if the pregnant woman contracted the virus in the first trimester. Immunity status should be investigated to work at the viruses in the first trimester or pregnancy. So, in order to prevent birth defects because of viruses such as rubella, it's very important to check the mother's immunity against those viruses. Or we can just simply ask her if she has taken any vaccination against like MMR. Why MMR? Because rubella is well known to cause malformation, and those malformations are really very sweet, and we usually offer the mother abortion if she contracted this virus during the first trimester. Okay? 10 minutes break. Okay, 9:20, we come back.
مشكلة أمان عنا مجال ما فيش عنا الموقف يعني أنا يعني سوشيال ديستنس بس أنا شو مثلا سبيسينج وينشر مثلا التشيرمان تغيرها هدف من إجراء هدف الدين by next week. Yeah. What's the name? Students? 12. It's 12. It's 12. I want 12. Yeah, it's 12. The minimum and maximum is 12.
Is it co-ed or just by
It's just males and females.
separate males?
Yeah. Yeah, I'll announce it.
Because they were confused. Like,
Yeah, we'll announce it.
males only, it's only 12.
Okay, it's males and females. 12 exactly. 12 exactly, no less.
No less than بس مبدئيا خليهم يتعذبوا يعني ما بعرف الدكتور خالد كل ما تيجي القصه انه حتى الانجينير مالك الفاسيلتي جاني جنانه انه هو متحمس انه اخي يفوت يخلي سكيورتي يبعدوا العالم عن بعض قصص معلش لا تعقدون لا كذا فما حد عرفتي بيجوا الكلاس قال لك الكلاس ممنوع يقعدوا جنب بعض والتشيرمان هذاك عامل قصه طويله وعين تي ايز ما الطلاب كمان يعني ما بيفهموا اذا بيروحوا بالكامبس بيعملوا بالدنيا
معلش انا بعرف انا قلتك
فانا قلت والله علي انا من محاضرتي انا محاضرتي اخي رجاء تصطفلوا
لا بعدين عفوا يعني انهم بيروحوا بالفود كورت قلت لي انت قاعدين بعض يعني
هو كل ذكرى يعني هلا ما شفت انت اول ليكتشر انا شوفوا بنت وانا قاعدين عم بضحك حكي بصحصح وقاعدين
ما صدق
فانتوا برا ماشي انا محاضرتي
I think it's the topics are one of these 10,
yes
or do we choose from?
No, it's one of those 10. It's just just classified.
And for each one we have to get the diagnosis.
So I'll talk about it now after Dr. Racha's
Yes.
lecture in more details.
Oh, okay.
Clarify
So it's
the
10
topics and it's what?
It's 10 topics. We have to choose from.
It's 30 something topics.
لا هو he's asking
Yeah.
does he need to choose like this one
Yeah.
go through the
No, you
every-
choose
no,
one.
no, no.
It's one.
It's just one of those.
Yes.
Yes,
Oh,
yes,
okay.
yes.
Yeah, it's just different classifications
Yeah.
for them.
You
but
just have to talk about the 4 aspects before COVID, after
Yeah, yeah.
COVID, and that's it. Yeah. بعدين تعلق مستحيل.
انا هعمل لهم جدول على جوجل فورم. كل توبيك لحال
بس انت
حطوا بس
هلا
اسم
مبدئياً
الجروب
إنه
يعني بس
شغلة-
عم ورجيهم احنا اصلا كانت لنا بس عشان نحطهم كتاب رابط ورجيهم شو بس نعمل جوجل فورم.
Yeah. So let's move on. Let's say hi. Okay.
Yeah, sit down, please. We need to finish, so Dr. Salim will also explain to you about the project. He will elaborate more. So we need to finish in 15 minutes. Sit down, hurry up.
هذا البوديوم اللي هون والله كافي. هذا بيقطع فجأة.
هذا صار له بيقطع 3 سنين ما عرف يحلوا لنا
أبداً.
صار له 3
I
سنين
know.
بيقطع مو معقول.
هو I think لأنه له مجال معين يعني رينج معين.
3 سنين
الماء
محاضرات
كان-
كونفرنسز وكل
عن
الناس
جد.
تشتكي
بعدين أنت شوف بناء الستيج كله بحط الطهارة.
لا لا في كل مبنى 6 شهور عم يخرجوا والدفعوا هذا كله مبنى كنت انا طالب سنه اولى طلع هيك فجاه بوب صار في مبنى هون كان ما موجود اصلا هيك بس هو ايه هون يوم كان عم
هيك
جرب لا 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 ما شفتي دكتوره وراك شو فركش حرام
حتى أنا والله I make sure إنه دايما ورا. خلاص.
Okay. So we will continue. We were talking about birth defects. Sit down. Guys, there. Sit down.
Guys sitting at the back on the bench, both of you, can you please have a seat?
So let's continue. We have talked about birth defects and what are the public health recommendations to reduce the percentage of congenital malformation. So another actually recommendation of by the public health is to encourage all women of childbearing age to take folic acid supplements. The problem here, not all women respond. So what is the measure that usually the public health recommend in order for all women to take the folic acid is to fortify flour, the cornmeal, the rice, pasta, bread with folic acid. Why folic acid? I'll tell you why. Actually, folic acid usually protects against neurological diseases, especially spina bifida. As you can see here, the baby, this is the spina bifida. This is a kind of neurological disease. It might be mild, it might be so severe, and it might cause paralysis. So the woman, if she takes folic acid, because some women will not listen to their doctors or will not listen to the recommendations of taking folic acid as a supplement, so the public health offered or suggested to fortify all kind of bread or pasta or rice with folic acid in order for the mother to take the folic acid without even knowing. Okay? So let's move on to the second cause of fetal or of child mortality, which is preterm birth. As we said before, preterm birth, it means is to deliver the child before completed, and this is very important, completed. Not at the beginning of 37 weeks or 36 weeks, before completed 37 weeks of gestation. Okay? Death is due to respiratory failure and intraventricular hemorrhage. Causes of preterm birth, it might be environmental, such as pollution, nutritional, such as malnutrition, or social like poverty. Okay, so preterm birth might cause a lot of diseases for the child, such as respiratory failure or infections, and sometimes intraventricular hemorrhage, which means brain damage. Okay. What are the measures to reduce preterm birth and its complications? Of course, to educate all women in childbearing age, and then to screen the women at risk of giving birth too early. So who are the women who might give birth too early? Who do you think they are? There are some women who are at increased risk
preterm deliveries. Yes? They have very good narrow pelvis, so they might have something during the delivery. Yes? Very young mother, excellent. Very young mother, yes. Excellent. Multiple pregnancies or multiple or twins, yes. This is very good. And also, women who are poor. Women who are poor are at risk of having babies who are mature. Why is that? Usually they do not follow up with their health practitioner, so they might have something like pain in their tummy, they might have bleeding, they might have, or their membranes break, and they can't go to follow their doctors. So it's very, in order to reduce the preterm birth is to educate women, to educate all women about the preterm birth. Also, to screen the women who are at risk. To screen means to have multiple visits for those women who are at risk of premature delivery. Identify women with a preterm labor and take prompt measures to reduce the risk of preterm delivery. So at the same time, we have to that there are women who has the pain, abdominal pain, who has discharge, vaginal discharge. Those women might deliver before term. So at that time, have to take the needed measures. And then, of course, to have, in order to reduce also preterm birth and complications, to have an equipped neonatal intensive care units. Okay, in order to have those babies and put them in the special care, in order for them to grow properly and prevent any infections that might contracted by them. Okay. So another cause of child death or infant death is sudden infant death. Sudden infant death syndrome. SEDS. Did you hear about that? Yes. Okay. What does happen for a baby? And when does it happen, Joy? Unfortunately, sometimes the parents wake up in the morning and they see their baby is dead, and they don't know why. He's very healthy, he doesn't have anything within the first year. Those babies at risk of this sudden infant death syndrome during the first year of life. What happens usually? Or let's talk about American Academy of Pediatrics began a back-to-sleep campaign to educate doctors, nurses, and parents that infants should be put to sleep on their backs. It's very important to put the baby on his back while he's sleeping. Okay? Not to cover him with anything, not to put any pillow under his head, not put any toys beside. Let him wear, or the mother should put a jumpsuit on him, or any kind of overall, cotton overall to that baby, and he will sleep with that overall, okay, or pajamas. No need to cover, no need to put any pillows, no need to put any kind of toys, even cotton toys, nothing. On a firm mattress, okay? So, American Academy of Pediatrics began a back-to-sleep campaign to educate all the healthcare practitioners about the safety or to put their babies to sleep on their back. Public health agencies are working with communities of minority groups to educate them about the importance of putting infants to sleep on their backs. Other risk factors of SEDS are soft belly, being overheated, and bed sharing. Babies should not share the bed with their parents. Okay? It's very risky to share the bed with your baby. And also, don't, like here, and as a tradition in our world, what they do usually, they wrap the baby, keep on wrapping him till he looks like a sandwich. And he's so tight, it's very tight, and the poor cannot even move, he cannot do anything. But this will cook or overheat the baby. And that might be a reason of death. Okay? Parents should be told not to overwrap the baby, keep on wrapping. It's not a gift, it's not a sandwich, okay? To give the baby some space to move and something like this. Cuddling and just wrapping with this like soft one, not that tight, is okay. Cuddling is okay, no problem with that. But the overwrapping is not okay. Very good. So this is a very important slide. As we said, prevention of sex, the do and don't list for sexting. It's very important, as I said, to put the baby on his back, do not overwrap him, do not put any, do not cover him with any blanket, do not put toys. Pacifiers are very good and protects from sex during the first 6 months. Okay, but make sure not to hang the pacifier around the head of the baby. Okay, so do not put like anything or do not attach the pacifier with a string and then just wrap it or put it around the neck of the baby. Okay, of course, bed sharing is prohibited, or co-sleeping is prohibited, but room sharing is absolutely fine. It means that you put the baby in his bed and then you put him in your room. It's okay, but he has to be in his bed. Okay, this is the baby. You can see how good he is, and he's sleeping peacefully, not causing any problems. Okay, regarding children nutrition, breastfeeding still offers a healthy start in life. Public health organization recommend that the infants be exclusively breastfed during the first 6 months of life. Exclusively. Sometimes you might supplemental food, might start with supplemental food before 6 months, like at 5 months of age. It's fine. Sometimes there are babies who like to eat too much and breast milk is not enough for them, so you may start the supplemental food before 6 months. But it is recommended to keep the baby on breast milk for the first 6 months. After that, you start the supplemental food until another 6 months. So, yeah. So public health organizations recommend different kinds of programs to ensure adequate nutrition for poor families. And so public health, in order to for the poor families to have the adequate for families artificial milk, they have like programs to distribute what kind of formula if the mother has malnutrition and she cannot breastfeed her baby. Okay? Child health and safety. So, public health efforts to prevent childhood injury include education and regulation that encourage use of seat belts, car seats, and bicycle helmets. Also, public health measures to provide safe playing areas. So, in order to prevent injuries, it's very important to educate the parents about the importance of seat belts, of car seats, and of course should wear a helmet whenever he rides a bicycle. Okay? This is the car seat, and this is the... Let's talk a little bit about the car seat. This is very important, taken from the CDC. So, as you can see, yeah. So, in the first image, okay, on the left side, it's the rear-facing car seat. Whenever the baby is born, then he should be put in a car seat is rear-facing. Why do you think it's rear-facing? It should be rear-facing. Do you understand what's the meaning of rear-facing car seat? Yes, yes, please. So we put first of all the car seat at the back seat of the car, and the baby's face faces the, it's rear-facing. The baby's face faces the back seat. Okay? So you put it this way. You can see here. You put it in this way, so that the baby's face faces the back seat, or faces the seat of the car. Okay? This is usually recommended until the baby is 1 year or 2 years of age. Okay? But it is a must until the baby is 1 year of age. Sometimes it's okay to keep him in position until 2 years of age. Then, after age, we move to forward-facing car seat. Forward-facing car seat, the baby should be in this seat until age of... Turn the back. We go to the booster until the baby is like 8 or 9, and then of course, seat belt should be used when the baby is 12 and above. So the rear facing, when the baby is year of 8, bit older, but it is a must until he is 1 year of age. But if you want to keep it on this position for a longer time, it's fine. After 2 years, then we use the forward-facing car seat until 5, and then after 5, we use the booster. At 12, the baby or the child should use the seat belt. Okay. Any question? The rear-facing, yeah. There is convertible. Yeah, you can put rear and you can put forward-facing. No, this is not a question. Ask me after. Okay. And it's fine. Another question. Why do we put the car seat at the back seat, not in front? Yes, please. Yeah. Yeah. Very good, because of the airbags. Because the airbags might suffocate the baby in case of an accident. Okay? So it's very important the car seat at the back seat. This is the first thing, because airbags, and the other reason is if we put it on the seat, then the baby's head might smash the window or get injured in the window if an accident happened. Yes. It's not dangerous, it's the opposite. It's very safe. Because here he's not looking at the back. It's at the level of the seat. Exactly. And if there is an accident, the baby's head will hit the back. Yeah. Sorry? Oh, this is very smart question. What do you think? Should you leave the baby just sitting at the back seat by himself? So the mother, if she's not driving, she should stay beside him. And the father, there should be someone who is with them. Especially if you are going for a long distance. But it's like 15 minutes, 30 minutes, especially babies during the first year, they tend to sleep while they are in the car seat. So it's very important to protect them if an accident does not happen. Okay? The other safety measures to protect the babies from injuries is to put stoppers on the doors, to put trails, also bed rails. Okay, what about childhood asthma? Do you know what asthma? Actually, asthma is a chronic inflammation disorder of the airways characterized by an obstruction of the airflow. It's a chronic inflammation, and it makes the airways narrower, and that's why the baby might have a difficulty in breathing. Okay, childhood asthma is a significant public health concern. Its prevalence grew dramatically in the last 2 decades. Why is that? Because of the environmental pollution. Okay, environmental factors are responsible, as we said. Other childhood issue, we have the tooth decay. I'll talk about that in oral presentation. Tooth decay, one of the achievements of public health is the fluoridation of community water. It reduced tooth decay by more than 50% in children. Putting fluoride in the water, that reduced the decay, tooth decay tremendously. And also we have for children who are able, there were measures taken by public health to provide programs in order to help those disabled children live a normal life. Okay. Thank you very much, and have a nice day. Dr. Steve will brief you about some stuff regarding the project, and if you have any question, you may ask me.
So, just regarding the groups, please, male and female are going to be separated, and the number of students that is required for each group is 12 exactly.
It's very important.
Guys, have a seat. The session is not done. So regarding the groups, you have till next week to choose the groups, males and females separate. I will send a Google form or a Google Doc, which I know I'm gonna regret, and I'll give you the ability to edit it, and then it's gonna be a table basically. You will, as a leader, so each group will have a leader. As a leader, you'll put your name, email, and ID next to the topic of your choice. So first come, first serve. I'll put the topics I put, I'll put them in a table, and you just put your name and ID next to them. Can you have a seat, guys? So, if anything happens wrong, if someone, because you can write over your friends and you can take their topics, if I receive any complaint, I will randomize the topics and assign each group a random topic from my choice. So I'm giving you, I know you're not mature enough for this. I can see that from, the way you're seated, and I have to spend the whole lectures, trying to keep you apart. But I'll try my luck. I like sometimes to gamble on new batches to see how they do. So I'll try my luck for a week and see how it goes. Any questions about the groups? So one topic, these topics, the ones that are right here, you choose one of them. So electronic medical records is a topic, blood sugar monitoring is a topic, and so on and so forth. For that topic and what is required from you and all these things, we will have many, many opportunities to discuss this in the future. If you are unsure about a topic and you want to ask, you can send me an email and we can have a discussion about it before you choose it. Any questions about the groups? You ladies have attendance issues? Can you please come here? Okay, now you can leave. Thank you so much. What's your ID?
211
211
051.
05. Lina?
Yeah.
Okay.
Thank you so much.
You're welcome.
Athena
ID.
Suhail, 22
22
15
15
43 4.
43.
Yes, Athena Suhail.
Okay.
Thank you.
Welcome.
Dana,
ID.
221424.
Done. Done. Thank you.
Thank you.
Next.
Lara,
ID.
191 32.
Done.
22 1647. Yeah, how many?
Done.
Thanks.
Thank you.
22 1606. Thank you.
Welcome.
221
221
660.
6
60.
60
16.
16. Sorry. Sana?
Yeah.
Okay.
211
211
644.
6 4. Done.
221 456.
Next.
210 323.
Yahya? No.
So, the first name.
The first name?
Yes. Abdelmas.
Fine. Done. Next.
Wael,
ID.
220 100.
Done.
Thank you.
Next.
220098.
2200
98. This brother. Yes.
Adel?
Yeah.
221 76. 221045.
Done. Thank you.
211 25.
طيب. 21125?
Yeah.
That doesn't exist.
211125.
Jude?
Two one zero 60
210?
60.
Hani?
Yeah.
Aya
What's your ID?
2210 3 something 36.
Yes.
The topics, they cannot be repeated.
No.
So how do we reserve a topic?
So that's the thing. I'm gonna send. Okay. Guys, all the documents for the groups and the link for the Google Doc is going to be on Moodle about lunchtime. So around 12 noon, the link will be there. So I will not send an email. You'll just find the link on Moodle with the file that says, the topics, that says all the descriptions you need. You just enter it and choose and put the name next to the topic.
Thank you. الانترنت لاج وما قدرت احضر الانترنت.
What's your ID?
221
221
557.
ميمونة.
Yes.
تمام.
شكرا.
Done. Welcome. ID 221
554.
554
551.
1. Dua.
Yes.
Done.
Thank you.
Welcome.
Doctor, what the problem with the first account? I came to you and showed you